statewide system introduced last year to make it easier to access mental health resources is a success, according to experts. North Carolina's 988 Center has received more than 65,000 contacts since launching last July. WECT's Zach Solon combed through the data to see how the 988 system is progressing. Now, Zach, you said that the demand for help and all these contacts is actually outweighing the supply of therapists available to provide the help.
That's right, John. Ryan Estes with Coastal Horizon says the state's mental health system is at a critical point where people are needed to keep up with capacity. In the first year of the new 988 Crisis Lifeline, the state health department says more than 65,000 people in North Carolina have reached out looking for help. Coastal Horizon's COO Ryan Estes says the Lifeline has been a crucial resource.
We're in a really fortunate position that 988 is a resource and people are gaining awareness, stigma is being broken down, and so that is certainly increasing access.
Estes says that increased access has led to more people getting help, but adds that the pandemic created issues for the system that are still felt today.
COVID-19 is still something that has crippled our mental health system. More and more people lived through a pandemic that brought about anxiety, depression, and we're disproportionately seeing it with children. And so those are reasons why we're seeing more people accessing services.
Calling or texting 988 will put you in touch with someone that can connect you to mental health resources, refer you for support, or give you someone to talk to. Estes says, however, the demand for help outweighs the supply.
We're actually at an inflection point of the mental health system that there are more people that need resources than we can accommodate as a system. That's why upstream approaches of working with the universities, get more students into the field, working with the state to potentially pay for paid internships.
He is hopeful those efforts will lead to more resources.
Until we can start to address the supply of therapists to meet the demand, we're going to continue to see a mental health system that is struggling to keep up with capacity.
Data from the state health department shows fewer than 1% of calls to 988 have been diverted to crisis care, which includes calls to 911 or a mobile crisis team. Zach Solon, WECT News.